Okay, well, it is noon and I'm going to go ahead and start because we have so much to cover and I'm sure we'll have a lot of folks joining us. But just to get started, welcome everyone. We have an amazing panel with us today to address a variety of issues related to COVID and the cultural community. To ensure that we can hear from each of our panelists, I'm going to ask everyone to hold your questions until the end or post them in the chat, and they'll be addressed in the Q&A section at the end of this first session, or at the end of the panel session. And I want to remind everyone to stay on mute unless you're speaking. And just remind everyone, we also are recording this, so it will be posted on the DACAC website for people who couldn't attend, or if you want to go back and check in on things. So let me introduce our panelists. We have Dr. John Carlo with us today, a public health physician and chief executive officer for Prism Health North Texas. He also serves as a public health consultant for the U.S. Department of Homeland Security, and prior work includes being a program director for the Center of Infectious Disease Research and Policy at the University of Minnesota. Prior to this, he served as the chief epidemiologist and medical director, Health Authority for Dallas County Health and Human Services. He serves on the American Medical Association's Council on Science and Public Health and is past president of the Dallas County Medical Society. He received his medical degree from our own UT Southwest here in Dallas, and he will give us guidance and perspective on how to safely plan our cultural activities. We also have with us Raha Assadi. She is a labor and employment attorney at Jackson Lewis and member of the Dallas Bar Association. She is also a member of the Dallas Association of Young Lawyers and volunteers for the ACLU of Texas as a legal observer. She interned for the U.S. Equal Employment Opportunity Commission while in law school and received her JD from Baylor. She's an active community volunteer and serves at DFW Refugee Outreach Services as a volunteer translator and is a member of the Human Rights Coalition. And she ran for Dallas City Council District 2 in the most recent election, where we were most impressed with her passion and support for arts and culture. And she will give us guidance on the legal implications of safety requirements for staff, artists, volunteers, and patrons. And finally, we have Kathy Liu with us from KERA. She's a coordinating editor there at KERA 90.1 FM, as you all know, our local NPR station serving North Texas. And she has been working with editors at KERA and the Dallas Morning News on a journalism collaboration to boost arts and culture coverage in the region, something we all welcome. And she has more than 2 decades experience in journalism, both at newspapers and public media, and is based in Kansas City, Missouri. And she's currently been working with the Dallas Morning News and KERA on an ongoing survey to assess the willingness of the public to return to live cultural venues and events, and will share the most recent information on public perception regarding when and how they will consider coming back. So let's get started, and we're going to start with Dr. John Carlo. So we will turn it over to you.
Well, thank you, Joanna, and it's good to see familiar faces and friendly faces. Regret that we're not able to do this together in person, but it's still with the ability of video conferencing. It's just nice to see friendly and healthy faces today, and I'm just honored to be here and happy to participate. I'm going first with the esteemed panel, and the first panelist's job is to never go over time so that we don't let the last panelist not have enough time. So I want to do my part to at least set the stage, give you some perspective on what's going on, what I think is going to happen, what I think you're going to need to hear as the arts community, what you're looking for, what's going to happen next, all of those things that I think we're all wondering. And unfortunately, I may not have all of those answers, but I certainly will try and give my best, and certainly will entertain your questions and look forward to them. You know, I've studied pandemics. One of the things that's been a part of my career all the way from the beginning, even before being a part at the health department, was this idea that an emerging infectious disease could come into our world and wreak havoc and devastation to the extent of what we had seen way back when in 1918 during what we called the Spanish flu or the influenza pandemic back in 1918. And so I've watched all of these things unfold from a historical perspective, studying kind of the impact over the years, but also being a part of these other pandemics that have happened in emerging infectious disease threats, starting in 2003 with SARS. You know, we have, of course, have had the HIV and AIDS pandemic here in our community since 1981. And we've continued to have issues in Dallas. We're very unique here because we've been beset with all sorts of crises of emerging infectious diseases, from West Nile virus to Zika to Ebola. So this is a very unique community because we certainly are, I think, probably one of the most experienced areas in the country in terms of having to manage infectious disease threats, to a point where I was frankly surprised. You may have heard something about this a few weeks ago, but it didn't really rise to the level of attention that we had a couple of cases of monkeypox arrive here in Dallas. And I think we were so, I guess, absorbed with everything else that was happening around us that we really didn't notice it too much. I was kind of surprised. And that was, that's a big deal. So I just sort of signed that up as this is where we are today. And it is quite a remarkable time. One of the things I sort of want to start off with in this historical perspective, and this was framed very well from a colleague, Howard Markle, who's a medical historian out of the University of Michigan, who wrote in The Atlantic about a week ago, sort of said, stop trying to compare the coronavirus pandemic to the 1918 pandemic, which was sort of surprising because that's kind of how we've been doing things up into this date. And his points were, we've never had this to this extent from a couple of areas. One is that there's never been such a heavy politicalization of an infectious disease pandemic to experience that we're experiencing now. So it is unlike what was in 1918. And we've already surpassed the number of deaths from 1918. We're now well over 675,000 Americans who have died. 1918, we had just 500,000 is sort of the estimates, making a point, of course, that the population was much, much lower back then. But what I had talked about before, and I thought it was important, was that the idea of having the pandemic in 1918, with its devastation and everything that happened over those 2 years, opened up the next chapter of American history, which we know as the Roaring '20s. And so we had sort of described this sort of sense of optimism as a reflection of that history, recognizing that the Roaring '20s was one of the greatest sort of acceleration of everything that is wonderful, from the arts to just really the rise of the middle class and just the economic prosperity that was really reflective of that time. And so that sort of, I was using that as a sort of hopeful way to sort of say there will be a day, we will get through this together and there will be a better time ahead of us. I'm not saying that that's not going to happen, but I think that Dr. Markle's point is well taken, that we shouldn't really take that from the experience of 1918 to mean that the Roaring '20s will return. That may not have been an automatic connection piece, especially from what we've seen so far, which really seems to tell us that coronavirus, as this emerging virus is happening, does not seem to be lessening in terms of the capability and ability to cause infections in human beings across this planet. You know very well the terms, the variants at this point. The Delta variant, which is now really the predominant strain across the planet, and certainly here in this community, very, very infectious, so much more infectious, surprisingly more infectious than what we determined as the sort of original strain, or they call it the Wuhan strain. Really tells us that these variants are here to stay and are going to continue to occur. And the other thing that's concerning about that is how quickly these variants have not only emerged, but also how quickly they've circulated and become the predominant strain across the planet. This is not something we have seen before. It's certainly not what's typical with influenza. And with that in mind, knowing that there are so many infections occurring right now today, and knowing that this virus has this propensity to make these variants and changes, it's just a mixture to really be safe in saying that unfortunately we're going to have future variants and iterations to come, and likely these variants will contain the ability for the virus to escape the existing immunity or the virus, the vaccine itself, and the protection that's been afforded to us. So, I think we have to be pragmatic in understanding that there may not be a victory ahead in just a short amount of time. I certainly hope there will be, but I think we have to be practical and pragmatic. This might be with us for some time. And we're going to have to sort of deal with that reality together and face that with the perspective of we've got to think about what happens in the next 6 months, but also in the next 6 years, and understanding that context. So let's talk a little bit about what's happening today and right now, just to kind of give you a sense of where I think we are going to be headed in the next phase of the next 6 months, because I think that's probably more than anything else what this group would want to hear and understand as best as we can. First is, we've got the vaccines, and let me just reiterate over and over again. Thankfully, we had yesterday great news that the Pfizer vaccine has been fully approved by the FDA for ages 16 on up. It's available under emergency use authorization from ages 12 to 15. We have another vaccine that's called the Moderna vaccine that is a very similar age group, and both of those are working extremely well. We also have several other candidate vaccines that are in the pipeline. We also have an approved single vaccine by Johnson & Johnson, which is an adenovirus, a different technology vaccine, which is, there is a lot of discussion about the differences in efficacy between all of these vaccines. To me, there really isn't a difference based on the data. A lot of that has to do with when the studies were done and how they were done around the world. So what the basic message is, all three of these vaccines are great. If you have the opportunity and haven't gotten one, any of those will work fine. And I don't think there's one better than the other. There's not any indication that there's certainly one better than the other. A couple of emerging things that have happened. Last couple of weeks, as you know, we now have a recommendation for a booster dose for certain individuals that have clearly defined conditions, medical conditions that would put them at higher risk, that the vaccine may not have worked as well in making that antibody response and making that immune response for those individuals. And so there's a list of medical conditions that are applying to this recommendation for a third dose. And, there's going to be a lot of questions about that. And certainly I'll try to answer those any specific, but a lot of those questions have to go to everybody's personal physicians and making that risk assessment, determining whether that third vaccine is a good choice for the individual. But even without the third or the booster vaccine, a couple of things we know is the vaccine is working very, very well. And I say that understanding that we are hearing a lot of what we're calling breakthrough infections. I think we understand that is the case. The current sort of analysis is that you're about 7 times less likely to have an infection if you've been fully immunized with one of the approved vaccines with this Delta variant. So, we know it's not 100%, but certainly great odds around preventing infection. The other part, of course, is you're 25 times less likely to be hospitalized or suffer death from coronavirus if you have been vaccinated. So there's really an overwhelming sort of benefit clearly still there that affords us this opportunity to still say we have a great vaccine, even under the Delta variant. Why is the Delta variant escaping the vaccine or causing it breakthrough infections is because it is so much more infectious than the previous variants that we've seen. And so this is understandable just given the degree of infectiousness that this new variant is causing. So, not good news overall, but actually good news, I think, in many ways that we still have a good vaccine that can prevent hospitalization and death. With that in mind, our hospitals right now are really approaching a crisis. And I don't want to sort of sugarcoat the reality of where we are in the next couple of weeks. Our hospital bed capacity is nearing full capacity. Particularly our children's intensive care unit beds are really, really under struggle right now, making sure we have enough beds available for our kids who become really sick. The good news is kids as a whole don't suffer severe illnesses like adults do overall. So we have less children's beds overall, which makes sense because our kids thankfully are healthier. But now that limits us because there's so few children's ICU beds. And we're doing triaging and transfer of some kids as far as up to the state of Idaho to make sure that beds are available right now. So it is really a crisis situation today at our hospitals. And certainly our thoughts go with all of our healthcare teams who are tired They've been at this for a long time. You know, these are our heroes on the ground. I know these are friends and family of yours, and so be sure you thank them when you see them, because it's been a tough road for particularly our ICU nurses and our critical care specialists. Where I think we're going to go, it's been a remarkable peak. In other words, we moved so quickly through the cases starting sort of the June, July timeframe, where we were at that level where I was happy, which was a 3% positivity rate. We just got under 3% for the entire state. And what that means is for all the coronaviruses tested, ruling out that that's infection, only 3% were coming back positive. Well, now we're well over 16%, going from 3 to 16%. But also in an incredible short amount of time. This peak has been so much faster than even what we experienced in the wintertime. And one thing I guess is hopeful in some ways is epidemics very typically follow a bell-shaped curve. In other words, it's very unusual to not see what we would call a normal distribution of case rates, which means as quickly as they go up exponentially, we'd hope to see that fall go down as quickly as well. And so hopefully this is a very sharp sawtooth type curve, which means, for the next couple of weeks, we can anticipate a pretty strong peak. Probably the UT Southwestern modeling folks are predicting into mid-September where we're going to see this peak. But hopefully that drops down very, very quickly. And, I guess there is some hope as quickly as we saw this rise, it could fall just as quickly. With all that being said, this is such a new thing for us in terms of the virus. This is a new concept. I'm not sure the virus is willing to follow our models because it's going to do its own thing, as we've learned. And so we have to be aware that, we may not know really what this is going to do, especially under these conditions. The last thing I would sort of talk a little bit about, we talked a lot about herd immunity. You remember kind of that idea. I used to run a lot of races and marathons. It was like that herd immunity was that finish line where you could stop running and stop your watch and have a cool drink of water. Herd immunity is not really, I think, a sustainable idea in this concept because we're having all of these new variants constantly be introduced into our communities. And the other part is it's hard to frame herd immunity in today's society when we're so mobile. In other words, Dallas doesn't sit inside a castle wall where all of the community just stays there sustained and it's a defined community population. There's going to be constant mixing of people in and out of our communities, constant mixing of the virus and the variants. So really, unfortunately, this herd immunity idea is less and less talked about because I think we're knowing that it's harder and harder to say that that's what we're going to achieve. But we certainly know with the vaccine rates being what they are here in Texas, we're well under what we need to do in order to control this unsustained outbreak that's currently happening right now. Now, the other parts about some of this is that masks, just to mention the mask use, because that's been obviously talked about to a high degree. It is, I would say, and I will be honest, from a public health person that has read everything about masks from the beginning and understanding infection control, up until March of 2020, we had very little confidence that public mask use would actually be an effective way to prevent transmission of viruses back and forth or infectious diseases. We have changed that thanks to real world evidence. And we stand corrected, and I'm happy to say that we have corrected that thought process. And we do know now that individual protection using even the cloth-based masks that we're doing actually does work and actually shows a benefit in the overall case rates and individual protection. So we do have a great tool. We need to continue to use it. The other part is there's absolutely no harm in wearing a mask. I've been reading some really interesting things about carbon dioxide overload and people wearing masks or something to that effect. There's just absolutely no harm that has ever been proven from something like wearing a cloth mask over your nose and mouth. So there's no reason to stop doing that. And I think we all get it, that it's incredibly important. And it's something that from individual protection we should all understand. But I also think it's back to a civic responsibility to not only protect ourselves, but protect our family, our loved ones, and those in our community around us. So I think that that's something we'll continue to have. And, you know, as many have sort of remarked, this may be something with us for a long time. And I may not personally, I think you might agree, going to a busy airport in the future, I may be comfortable keeping a mask on among all the crowds of people and going through that process. And that may, especially in the cold and flu season, why not? It seems to have worked now. So we may see a new element that as a result of this experience and the learning that we've done. So, you know, I don't have a lot of other sort of tidbits to provide. I think that one sort of other question I might answer that I just answered today, we're not sure when children under 12 will have availability for the vaccine. We're saying that the FDA is highlighting maybe by the end of this year or early next year that it could go to ages 5 to 11 for the Pfizer vaccine. Moderna would slowly follow out to there. They are testing it in kids as young as 6 months. So we hope to have that information as quickly as possible. There has been a push by a number of groups to have the FDA really be as aggressive as we can be in getting approval in these younger age groups, because we know this is a huge issue for our schools and really protecting our children in classroom settings and things like that. That ties into almost everything we do, because if we can't keep our kids safe, it affects, I think, through all of the things in our community and our gatherings and what we do as a whole. If we are not assured that our kids at home can be done, are able to be safe. And so that's certainly something I hope we can see very, very soon. You know, I think that's the big story. And there's a lot of sub stories that go into this. And we've got so much news and information that's in front of us around it. And I just would sort of say at the end of the day, you know, we may not have the roaring 20s as I would have liked to have relived all of that. And as I think all of you all in the arts community might wish you had at least had some of those experiences. But I do think we have an opportunity to create what that will look like for us in the future. And I do think that there will be a time where we're able to do that. And I do think that given how much we have sacrificed as a result of this experience, it does give us a lot of energy to be able to put forth that effort once we have the opportunity to do so, to do some things that are great in our communities and really get there. So until that day, I'm certainly here with you all as strong supporters of everything that you all do. And I'm just happy to be among you all, and we'll pass back to Joanna, and thank you, and look forward to the questions at the end. Thank you.
Dr. Carlo, thank you so much. And I'm going to ask everyone to hold their questions. Hannah's just put that in the chat. You can go ahead and put them in the chat, and we'll have a Q&A after we've heard from all three presenters. So go ahead and post your questions or hold them till after we have completed all the presentations. So I'm going to turn it over next to our attorney, Raha Assadi. And she has a PowerPoint presentation that is going to help us understand a little better some of the legal implications around COVID. So I'm going to now turn it over to Raha Assadi. Thank you.
Thanks, Joanna. Hi, everyone. My name is Raha Assadi. I'm going to share my screen. So can we all see it okay?
Yes.
Okay, great. So like Joanna said, I'm a labor and employment attorney, and I'm going to talk about a few kind of big implications for kind of operating in a post-COVID workplace. And I'm going to preface that there's a lot to cover, so I'm going to fly by. But if you have any specific questions, my email address is at the bottom left. You can feel free to email me, call me, whatever. And some kind of the agenda we'll talk about mandating vaccinations, potential liability, other considerations, and some resources for you guys. So first, there's really not a lot of specific regulations in terms of how to operate in the performing arts or just, you know, in arts in general. So a lot of this will be pretty generic and apply to all workplaces. So some big sources that you'll want to kind of periodically check are the CDC, EEOC, and OSHA, and those are kind of the where you should get all of your guidance from. Of course, there's also state and county specific laws, and I'm sure a lot of you have a lot of questions about the governor's executive order, and I'll talk a little bit about that too. Of course, we know August 11th, Dallas County Judge Clay Jenkins reinforced the mask mandate for all businesses. So we know that, you know, all of our performing arts centers will be able to enforce masks. And of course, all of these sources that are on the screen are not binding, but they're guidance. So, you know, you don't get in trouble if you don't follow it to a T, but it's just the best practice. So Governor Abbott's executive order essentially bans proof of vaccination for businesses and public entities. And so what this means, to kind of clear up some confusion, is any entity that's receiving any sort of funds or assistance from the state. And so you'll see the little asterisk at the bottom. That can include grants, contracts, loans, disbursements of taxpayer money. So, you know, we think of TABC licenses, for example. I'm sure a lot of arts organizations get grants. So all of those kind of fall into the category of organizations that cannot require proof of vaccination for its customers or attendees, you know, things like that, which is, in my personal opinion, really unfortunate. It's being litigated in the courts, in I think several courts right now. I don't know, if I'm being honest, I don't know if that's going to last. And I think, you know, there will be some court that somehow is able to overturn this. But for now, you know, just thinking about your organization in particular, if you know your organization's receiving money from the state or has some sort of contract or agreement, then likely this applies to you, and you won't be able to enforce, you know, vaccinations for your guests. So that's different from employees. So just keep that in mind. So, of course, we know that the CDC has provided guidance that says you can enforce vaccinations for your employees. It's now starting to be seen as a sort of condition of employment, whether it's for hiring or continued employment, sort of like a job qualification. And the EEOC and OSHA have actually, this is not new, the EEOC and OSHA have permitted mandates for flu vaccinations. And so, you know, this is sort of in line with that. And of course, the EEOC has also said that employers can lawfully choose to test employees for COVID-19 before permitting them to enter the workplace. And we'll talk about that a little bit later in terms of how that really plays out. And the EEOC guidance is consistent with the CDC in that employers can require its employees to be vaccinated. There are two big exemptions that employers should keep in mind, and you know, that applies just the same to arts organizations. So the disability and medical exemption, basically this says, you know, people who may be allergic to a component of a vaccine or may, you know, be at risk for an adverse reaction can get an exemption for, you know, the vaccine requirement. There's also the religious exception. So some people may decline vaccination because of what's called a sincerely held religious belief. And that is, of course, a term of art that's really open to interpretation, but that is also something that can, you know, allow an employee to get out of the vaccine requirement. The ADA requires reasonable accommodations for anyone requesting an exemption. So, so any employee who, you know, who claims that one of these exceptions apply to them are entitled to some sort of reasonable accommodation by the employer. So what that means is it really can be anything. So, for example, unvaccinated workers can be required to wear masks, social distance, work in a different, you know, wing or space, can, you know, have required, you know, weekly testing, daily temperature checks, an opportunity to work remotely. So any sort of accommodation that doesn't unduly burden the employer. And that's, again, a term of art that is sometimes open to interpretation. But so long as it's not, a significant difficulty expense on the employer, that accommodation can and should be provided. And another ADA consideration, if a vaccine mandate screens out or tends to screen out an individual with a disability, the employer has to show that that unvaccinated employee will pose some sort of direct threat to the health and safety of others, other employees, that can't be eliminated or reduced by reasonable accommodation. So that's sort of an exception to the exemptions. So a best practice, and this is actually something that my employer has done and a lot of others are doing, is to survey employees to see, what percentage are vaccinated or plan to get vaccinated or would like for their coworkers to be vaccinated. And this just helps determine whether to mandate vaccinations for employees. But of course, a consideration that we'll talk about later is you can't ask why employees are not being vaccinated. You can't ask what medical condition prevents them from being vaccinated, because of course that goes against HIPAA regulations. So again, EEOC has provided guidance that says, employers can require proof of vaccines. But one thing that needs to be kind of in the minds of employers or people making the decisions is that this can potentially open up some liability issues, which, like I said, we'll discuss later. Employers cannot mandate that the employee provide any medical information, records, or anything as part of the proof. Of course, the actual, proof of vaccine, the vaccination card, is permissible, but anything beyond that, that gives any sort of medical information beyond that, is not permissible. So, of course, the vaccination card is probably the best proof, but some people might lose them. Some people never got them in the first place, and so the best practice would be to ask for vaccination attestation forms. What that is basically a form that you require your employee to fill out that basically says, I either verify that I'm fully vaccinated, or I've chosen not to get vaccinated, but agree to periodic COVID tests, and just have them sign it. And the benefit of that is that because it's not created, because this form is created by the employer and not, a healthcare provider, it's less likely to run afoul any HIPAA violations. And of course, it's a form that you can require as a term of employment. And another thing that, we'll touch on later is if you have those employees that don't want to get vaccinated, you can require them to have periodic COVID testing. And that's pretty much the only thing that we can require of them at this point. And we'll talk about kind of who's responsible and everything like that in a few other slides. So one thing that I think is really particular to the arts world is that there are, of course, at-will employees, which are, and for this slide, I'm just going to use a hypothetical organization, ABC Performing Arts Company. So ABC has its employees that it hires directly, and then it has independent contractors, so contract workers, temporary workers, workers that are hired from a third-party staffing agency. So it's important to remember that the rights of these workers, the employees versus the temporary workers, they're not the same. So what you require of them is different. So like we talked about, at-will employees, you can require those vaccinations and proof of vaccinations. But for independent contractors, it really depends on the agreement that you have. So sometimes it'll be a direct independent contractor agreement with that individual. Sometimes it'll be a third-party service agreement with a staffing agency. But Ultimately, it will depend on the terms of that contract. So for existing independent contractors, it might be a little bit harder to require proof of vaccination because it's likely not already in the contract. But the good thing is that for future independent contractors, you can tailor the agreement or the contract to include the appropriate language in the contract that creates that requirement. And that's also the case with volunteers. It's hard to require really anything from volunteers because they're volunteers and you don't have any sort of written agreement with them. So the best practice here is to conduct a careful review of existing and proposed independent contractor agreements to incorporate language that really makes it clear that this employer is requiring proof of vaccination for employees and temporary workers. Something that employers are doing is incentives for vaccinations, which, if you ask me, is kind of crazy that we have to do that, but it's perfectly legal. There are just a few considerations. Incentives may be provided to encourage vaccination so long as you're not running afoul the EEOC's laws in terms of disparate impact. And the employee would simply just have to voluntarily provide proof of vaccination that they received from a third party, like a pharmacy or a health clinic or a doctor's office. If the incentive is tied to a vaccine that's actually provided by the employer itself, for example, the employer hires a company to come into the office and provide vaccinations, then it's a little bit stricter in terms of what incentives are allowed. The threshold here is the incentive must not be so substantial as to be coercive. So what qualifies as coercive is kind of an open question right now. There's a lot of undefined terms, but we can be confident that, lunch vouchers, gift cards, gift bags, things like that will probably be safe. Whereas, $5,000 in cash, for example, might not be so safe. And then these incentives only apply to the employees, not the employees' family members. So some potential liability, of course, there's a lot, but as much as I can cover in a short time period. So of course, medical confidentiality issues. The ADA requires that all medical information about an employee is stored separately from their regular personnel file. And this is so that it limits access to confidential medical information. So for example, we have the employee's application, offer letter, annual reviews, things like that. Those should be in a separate folder as any medical information. And that includes proof of vaccination, any communication from the employee that they've tested positive, any request for a religious or medical exemption, all of that should be separate. And then also, we see a lot of employers requiring, the daily temperature checks. That has to maintain separate as well. But also you have to have that employee's name as part of that log. So, it doesn't have to be anonymous, of course. You have to be able to keep track of whose temperatures or what. Employers may disclose the names of employees who have tested positive to public health agencies for reporting purposes. And this includes the third-party staffing agencies or contractors as well. And then we have of course, the transmission in the workplace. So, you have ABC Performing Arts Company, like we talked about, and they have two employees who work closely together. One got sick, and then the other one is now sick and claiming that the first employee got them sick. So one thing to remember here is OSHA has a general duty clause, and basically what this says is each employer has to ensure that the place of employment is free from recognized hazards that are causing or likely to cause death or serious physical harm. So all this means is that you can't really just ignore all of the guidance altogether and not require masks, not require vaccines, and do nothing and operate business as usual. So if it's the case that, ABC company is ignoring all of that and is not requiring masks or enforcing them, then that employee who claims they got sick from the other employee may have a claim against the employer. And then independent contractors, in the context of independent contractors, let's say this employee who got sick from the first employee was hired as an independent contractor through a third-party staffing agency. So in that situation, the third-party staffing agency and ABC company, they're considered joint employers. Again, another legal term of art. What that means is the responsibilities of the two of them are kind of joint, and the specific responsibilities will depend on what their contractual terms are, but there will definitely be some liability on the part of the in this scenario ABC company. And then, like I touched on earlier, the EEOC enforces Title VII, which basically—
Hi, Juliet. I was just about to send you a text message. Oh gosh, darn it.
I think she forgot she was not on mute. So employers must comply with Title VII to prevent disparate impact. And so this means that, you can't treat employees differently on the basis of their race, sex, national origin, age, so on and so forth. And we know now that certain protected classes have lower vaccination rates than others. And so from an equal employment opportunity perspective, employers really need to keep in mind that because some individuals or demographic groups may face greater barriers to receiving vaccinations, some employees might be more likely to be negatively impacted by a vaccination requirement. So just something to keep in mind. And then a best practice, employers should be prepared to show that a vaccine requirement or mandate is job related and consistent with business necessity in order to defend against any disparate impact claim. Basically what this means is if the employer is going to mandate vaccines, they should have a good reason to require it from everyone. And I think in the arts world, that's a fairly easy threshold, especially, let's say, performing arts, for example. Employees are in close contact, performers are in close contact, and, that business necessity is obviously there. And then other potential liability in terms of labor law, workers' compensation implications, an employee's adverse medical reaction to a vaccine that's mandated by an employer may trigger some workers' compensation obligations. So, if there's a workers' comp policy in place and the employee gets sick after being vaccinated, you should consider what kind of wages you'll have to pay while they're out. And then best practice here, implement a flexible leave policy for those who might have those post-vaccination side effects. And then just some other considerations, I don't know that this will be an issue specifically in the arts and culture world because people seem to have their heads on straight, but potential decreases in workforce as a result of vaccination mandates. We've seen a lot of kind of traditionally more conservative industries have a lot of people quit or resign because they don't want to have to deal with a vaccine mandate from their employer. And then this is kind of outside the realm of labor and employment law, but, patron safety, artist and performer safety, obviously making sure that, all of your precautions are still in place. And some specific things you can require for patrons, for example, will be, offering free masks, including statements on tickets that the purchase acknowledges that you're going to, follow the mask mandate, selling fewer tickets to ensure social distancing, and then, paperless touch-free ticketing system like QR codes. And then, kind of same idea with artists and performer safety, regular temperature checks and COVID tests, backstage sanitation, and maybe just limiting, the crew that's back there just to minimize contact. And then one note that I would guess some of you have questions about is, whether you can require guests or attendees to require or to show their proof of vaccination. And like we talked about with the executive order by the governor, unfortunately, right now, we can't require that our customers or our guests show proof of vaccination. But like I said, if you're not getting any sort of assistance from the government, you can. So for example, there are some organizations that have come out like Live Nation, AEG Presents, Austin City Limits. They're all requiring proof of vaccination or a negative test within 72 hours of the event. So that is perfectly allowed. And I will speed this up so I can let Kathy do her presentation. And some other considerations, of course, we talked about, you can require regular COVID tests, but if you want to, there's kind of an all or one policy in terms of testing employees. So you either test them all or you test one, but if you test one, you have to have a reasonable belief based on objective evidence that the employee might be positive before requiring the test. So you can't just kind of randomly choose someone to take a test. It's either, all or one for a good reason. Performing arts employers will likely want to test all employees, just, given the nature of the employment. And then paying for employee time to take COVID tests, that's another consideration. You'll want to think about how much time is spent every week or however often it is to pay for those wages while they're getting their tests. And this is probably something that's not going to be covered by insurance if the employer is requiring, for example, a weekly test. And then just some final resources. There are arts organizations all across the country that are coming out with these, just best practices, checklists, things like that. Those are certainly good things to think about. Of course, you're going to want to cross-check with CDC and EEOC guidelines to make sure you're in compliance. And of course, any specific questions, I encourage you to reach out to someone like me who practices this type of law and can give you more specific guidance based on your organization's needs. So, that's it.
Thanks so much. That was very, very comprehensive. And I know we'll have a few additional questions for you at the end, but I want to move on to Kathy Liu, who is going to share the results and understanding of the willingness of our audiences to return. So Kathy, I am going to turn it over to you.
Thank you. Am I sharing the right screen here?
Yes, we see your presentation.
Yes, you see that? Okay, great. Thank you. Thanks so much for inviting me. I know that KERA and Dallas Morning News are very thrilled to hear that somebody's been paying attention to our stories and our surveys. Just really quickly, some background. I'm a coordinating editor for a new journalism effort between the two newsrooms to create a collaboration to learn how to work together to better cover arts and culture stories in the North Texas region. And we only just started this whole endeavor in March. So we've been kind of figuring out how to work together, how to do stories together, and maybe even doing new ways of community engagement to really hear from our audiences. So the surveys are actually one of those tools that we've been using, and I appreciate anybody who's filled them out and who may have seen them. We've done 3 so far, and or if you've read the stories that came out of the surveys. So just so you know, this is a very informal survey. We basically created a Google form and shared that on social media at both Dallas Morning News and KERA channels. That includes Facebook and Twitter and Instagram. And then just had hope that people saw them and would fill them out. And what our first survey was actually about was back in June. And you remember Dr. Carlo talking about how they had 3% positivity rate, vaccines were rolling out, people were feeling really good about returning to the arts. And so just really quickly, here is what the June survey results said. 57% of people felt really good about attending in-person events. And it's it was really great to hear this, and our story was just about how arts venues were coming back into in-person events, sort of what precautions were they taking or were they looking forward to. And according to the initial survey results from June, out of 300 some people were also excited about coming back. Now we fast forward to now, where we launched the survey at the end of July into the first week of August. And this is a story that Joanna read and wanted me to share information about. We asked the same question: do you feel safe attending local arts events now? And you'll see here that only about 28% out of 1,400 people felt safe. So just anecdotally, that percentage really dropped between those 8 weeks or so. And a lot of that was certainly due to the Delta variant, to the positivity rates, to the fact that people were learning about how many people were unvaccinated and how dangerous it could be. Some other questions we asked in the survey were, do you want arts venues to bring back mandatory masking, which is something we've talked about? And you'll see here that most people were okay with it. Now, it's important to remember that, again, these are people who are maybe have seen our survey, who are already followers of the Dallas Morning News, who are already followers of KERA. So you want to be aware of who the audience is. But the sample size, you see, I was really blown away by, because it was so much larger than what we had in June. The responses were so much robust. We have so many comments. People were really, this was top of mind for people. People really wanted to find a way to talk about it. We also asked, if you are vaccinated, would you feel comfortable showing proof of vaccination if a venue asked? And I know we have that executive order, which probably wouldn't allow this in other places, but this was an interesting look at how people actually felt about it. And the fact that if it was allowed, that most people, at least out of this group of people, a lot of people probably would be okay with it. So that may be something to keep in mind if things change. So, oops, sorry, I went back to my, so some common themes. Oh, shoot, sorry. My hand got too heavy. So some common things I wanted to share with you too. The concerns for people who are worried about attending in-person events was spreading into young children in the household. And then there were people who work with kids, like teachers, or people who work with the elderly, as in people who work with nursing homes. They had this concern about, even though if they're fully vaccinated, about going out and being and possibly contracting the virus. People also mentioned they appreciated time ticket events because they felt like that was actually a safer way to attend events because of the limited number of people who would be there. Outdoor events were still really popular and were mentioned, and also some people mentioned going to things at non-peak hours. And also the rise of virtual events, the streaming, the interest in that has not faded. And that was something we actually talked about, we mentioned in our June story, was that a lot of people were appreciative of the fact that they could attend events now online and without having to leave their house for a variety of reasons. And one of them could include, I don't want to deal with parking, for instance. Another one could certainly be accessibility. And so they really hope that that would continue. And then many in our August survey said that it was the overall case numbers they need to trend downward before they felt safe enough to attend to indoor art shows with large crowds. Finally, just a really quick look at the demographics of our respondents. You'll see it's broken up pretty evenly between ages 18 to 64. And these are people who are arts patrons. A lot of them talked about how they were season ticket holders to a lot of different places. So, so this will hopefully give you a feeling for how those customers are feeling. Okay, and I think I'll just stop there so that you guys can move on to questions.
Great. I'll kick it off with a question for John. Based on the current recommendations for vaccinated people, what is the protocol for someone who could have an exposure to someone who is positive?
So, so if somebody has completed the vaccination series, in other words, if they're 2 weeks after the second dose or 2 weeks after the first dose, it depends on a couple things. One is exposure would be defined as being within 6 feet or less for greater than 15 minutes is a true definition of an exposure. So the current guidelines, as I've remembered them, as that you really there's not a recommendation for testing or surveillance unless there's anything specifically such as a high-risk medical condition or something that would qualify for more diligent follow-up. But if you were exposed, there really isn't any further guidelines. With that being said, what should you do? I think that it would make sense to go ahead and be watchful of your own activities during a period of about the incubation period of about 4 days, 5 days, and right now, to be safe, 7 days, I think makes sense. So if you have been exposed and you are vaccinated, it does make sense to not be exposing others. And so that would be really essentially kind of staying at home, avoiding other people where possible, being monitoring for signs and symptoms, and those sorts of things. One thing I forgot to mention in the my opening comments, I think is important. The other thing is there is active therapy called monoclonal antibody treatment that has to be provided before somebody is sick enough to be hospitalized. So another piece to this is if you do show signs or symptoms, it's possible that you meet a criteria for monoclonal antibody treatment, and that's showing really good success in preventing hospitalization in severe illness. So it is important to talk to your physician individually if you've had exposure or have symptoms, because getting tested early could get you in line for that monoclonal treatment.
Great, thank you. Raha, we have a question for you from Jeremy Wayne with the Turtle Creek Corral in the chat. If they require COVID testing as an organization for their employees, are they required to pay for that testing?
So they're not required to pay for the vaccination. A lot of the time, though, the vaccination comes at no charge, and insurance also covers it as well. But for COVID tests, likely the employer will be responsible for paying for that. So specifically, and I'll give you an example, my workplace, they're requiring weekly tests for those who have indicated that they're not vaccinated and don't plan to get vaccinated. And that's not really going to be covered by insurance or the employer's insurance. That will have to come out of the pocket of the employer.
Someone sent me a question for Raha, which is if you can't ask why someone is not vaccinated, how do you determine if they have a religious or medical exemption?
They should let you know. So if they have indicated that they have not been vaccinated and don't plan to, and this can often be in the form of, like I said, a attestation form where you require them to fill out one or the other, I am or I'm not, and it can be as simple as a checkbox to say, no, I don't claim any medical exemption or any religious exemption. I'm just choosing not to get vaccinated. But you don't have any obligation to ask if there's a medical exemption or a religious exemption. You are certainly able to ask, but you're not required to. But it's something that you can easily ask in a form or a survey that you require. But in theory, if they're saying no, they probably know that they have some sort of exemption that applies to them, and so they'll likely volunteer the information. And just a quick distinction there. Medical beliefs about what they think will happen, or just general ideas. I hate to use the word conspiracy theories, but secular ideas that are not related to any religion or medical beliefs are not accepted exemptions. So we hear a lot about the example of, I don't want to be microchipped, for example, that's not an accepted exemption. There's no tie to any religious beliefs there. There's no tie to any, medical concerns there. So all that to say, if they're saying no to a vaccine, they probably know that there's an exemption that applies, but you can ask them to check off that they're not claiming an exemption.
And I see Diana Crowder has posed a question, and this may just be for all of us to look at, as to whether there is a trusted source of information that would specifically relate to artists, to help them understand the difference between, what is real information about vaccines and COVID and what is misinformation. And I think that's a very good question and a hard one to answer. So maybe Kathy, do you have any insights on that as a journalist?
Actually, a lot of the respondents, many of them were artists themselves. They talked about having worked at arts organizations, or they miss being out giving shows, musicians. And this is actually a really interesting idea, because some of them did talk about really they want everything to come back so that they could go back to work, but they can't go back if it isn't safe enough. So I love this idea of maybe bringing some of those artists together just to talk about, how are they doing in the pandemic, but also like what are they wishing for, and like why do they wish for more people to be vaccinated, and maybe that would have impact. We're working on a story right now just about 3 artists, not specifically about getting vaccinations, but just about how they are managing to keep their inspiration through. We're now like 18 months into the pandemic and things are scary still. So we're working a story right now about that, about profiling 3 different artists. But I think just talking about the vaccination itself, that's a really great idea.
And I have a question for Dr. Carlo, and it's related to some information that's been coming out recently about the importance of good ventilation in preventing the spread of COVID indoors. And I wonder if you have any insights or guidance. That's obviously not an easy instant fix, and not something we have control over. If you go into a supermarket or a concert venue or an office building, you don't know what kind of air conditioning systems they have. But I just wonder if there's any guidance or information you can give us about how we can approach that issue as organizations and individuals.
Yeah, it's a great question. And it's an incredibly complex question. And a lot of times, as you're suggesting, we don't have a lot of control over the air handling and circulation of our indoor facilities, nor do we have a lot of, in Dallas, almost all of our HVAC systems are recirculation based. We don't do a lot of fresh air HVAC work for obvious reasons, because it's pretty darn hot and humid outside. So we'd rather take the air from inside. So that presents a recirculation risk. And to my knowledge, the filtration is not to a level where it could do enough to filter viruses. So there's really some limitations in what you can and can't do based on our internal environments. I haven't seen any set standards or anything that would sort of say this is what you need to do or this is what's better or worse. Certainly the evidence supports increasing ventilation, whatever that means. We have seen outbreaks in situations where there's not as adequate ventilation as there should be. Confined spaces with a lot of people, the density of people per space is something that's considered more risky, but there's not a fine, definite line other than making a effort to try to have enough distance in a facility so that people can stay 6 feet apart has been kind of the current guidelines that we kind of see. But there is other examples like airlines, and the airplanes have ways to manage that. And certainly you're less than 6 feet apart in an airplane. And there's been very little transmission in airplanes thanks to their circulation efforts. But yeah, it's a complex question. Unfortunately, no set standards that I'm aware of. If we certainly see them, we'll pass them along to others, because I know this has been a common question.
Raha, as we start opening up for the fall season, a question that we consistently are getting from groups is, what's the liability if someone sues you because they believe that they caught COVID at your performance event? What should we be watching out for that?
Yeah, that's a really good question. And because it's relatively still new, I mean, we've had COVID for 2 years now. There's not a lot of established case law on what is considered, true liability in terms of COVID exposure. Like I said, we do know that in the employee-employer context, there's the OSHA requirement that they maintain, a hazard-free workplace. But is your question in terms of guests?
Yes, correct.
Okay.
Guests coming in.
So, like I said, not a lot of case on that. My guess, if I had to, anticipate what the courts will start to decide, is that there will be a sort of implied assumption of risk. So, for example, if you are going to an event or going to a concert, by purchasing that ticket, you're assuming the risk that you will expose yourself potentially to COVID, and kind of that disclaims liability on the part of the event venue, or whatever it may be. But right now, there's not really a lot of there's not a threshold or any elements that you have to prove like there normally are with legal claims, and that's just because it's such a new and novel issue. So let's say, for example, someone wanted to file a lawsuit right now for that sort of situation. My guess is that they would have a really hard time proving that case. And the judge, even though they would not have any set authority at this point, to my knowledge, that says, the event venue will be liable, it's likely that the judge will rule that way. And by that, I mean, they will rule that the individual assumed the risk. That's just my anticipation.
Okay, well, we are going to wrap it up. If there's any quick last question, ask it now. And if not, we are going to thank our panelists, Dr. John Carlo, our attorney, Raha Assadi, and our journalist, Kathy Liu, for joining us today and for sharing what is really helpful and great information. We really, really appreciate it. And we have recorded this. It will be posted on our DACAC website within a day or so. So anyone who did not get a chance in your office who wants to review it, or if you want to go back to something, that will be posted soon. So thank you, everybody, and please be safe.
Thank you. Have a great afternoon.
Thank you.
Thank you.